We are we are going to enjoy this and have a good time. And so basically, guys, I have taken a tons of questions from all kinds of information and things I've been seeing in a lot of different health realms and public health forums and health committees and things about coronavirus and some of the studies that have been coming out and things people have been noticing and get you guys' opinion on it. I'm going to start with Dr. New. I'll ask a question, get your opinion. When you finish, of course, I'll allow Dr. Offit to get his opinion on the same, and we'll go from there and just kind of roll with it and see how this goes, you guys. I mean, I'm super excited to have you both here today. And Dr. Offit and I, we've known each other for about 4 years, and I think I've known Dr. New for about 2. I've known of him for longer, but we met about 2 years ago. So super respect you both. And I tell everybody this takes lots of fortitude, or also known as brass balls, for both of you to show up. So greatly appreciated. So I guess we're just going to dive on in if you guys are good with that.
Yep.
Yeah. All right. Awesome. So I'm going to start with Dr. New, and I'm going to read this to you. And then, of course, at the end will be the question here. Dr. Paul Alexander of Brownstone Institute .org has 150 studies showing that natural immunity is stronger than vaccine immunity. Studies out of Israel show that natural immunity is 13 times stronger than the vaccine, and in Qatar, it is showing 30 times stronger. Natural immunity has never been more ignored than it has been in the last 2 years. Do you believe that is true, and why do you think that is if you do?
All right. Well, first of all, I would just like to recognize Dr. Offit for being on the show with me. I know he may have gotten advice not to do this, but I respect and admire you for being here. All right. Yeah. I mean, the whole question of natural immunity, and this is really where I think things went off the rails for some of the traditional physicians, even people that, were very much into what the CDC was saying and mainstream thought, that, natural immunity has always been sort of the gold standard, the best outcome. Now, it turns out that the way the vaccine worked, because you're targeting a specific protein in the virus. I mean, you have instructions for the spike protein, that people would actually make more antibody to that spike protein if they got the vaccine than if they had natural immunity. The difference is, with natural immunity, you're going to make antibodies or have an immune response to more than just the spike. You're going to be targeting other parts of the virus. And so you're going to end up having a much broader, library of responses to whatever might come down the pike. And for a while, it appeared that, if you had COVID once, you probably were not going to get it again. All that's gone off the deep end with Omicron. Omicron apparently doesn't care if you've had COVID or if you've been vaccinated for COVID. It seems to affect everybody. But, again, I'm not really sure why this whole push for vaccinating people that have had natural immunity, where that came from, because we really don't do that. And Dr. Offit can correct me if I'm wrong, but we really don't do that with other illnesses. If you've had an illness, we typically will not vaccinate you for that same illness. So I'm not sure where that came from for COVID, but I know this is one of the issues that made a lot of people sort of stand up and say, why are we doing this? Why are we trying to vaccinate people that have already had a natural immunity? And it just, again, the Cleveland Clinic did a study. It never really was published. It was on preprint. Now, recently, I think as of the end of January, it was accepted for publication, but they added in data from Omicron showing that if you had COVID, yes, you could get it a second time with Omicron. Because like I said, Omicron seems to be almost like a different virus compared to what we had before.
All right, Dr. Paul, I'm sure I see you writing something down, so I know you have something to say. So let's.
No, just there were a few points there. Okay, I'm going to surprise you by basically agreeing with what you just said. I think, look at the CDC's own data. If you look at people who are naturally infected and compare them to people who were vaccinated, or people who were vaccinated and infected as compared to people who were unvaccinated, I don't think there's a huge difference between natural infection and vaccination in terms of protection against moderate to severe illness, as is true for virtually every other mucosal infection. It's true for human coronavirus, it's true for respiratory syncytial virus, it's true for the virus I worked on, rotavirus. There's no reason to believe natural infection wouldn't protect. I mean, there are those diseases where natural infection doesn't protect, like group A strep infections of the throat, which you can get over and over again, or gonorrhea, which you can get over and over again. But this virus, you can be protected. There are studies sort of on both ways in terms of whether natural infection is better than vaccination or vaccination is better than natural infection. And the reason is that not all natural infections are the same. In other words, if you have, it all depends on sort of the degree to which your immune system is challenged. So there may be someone who has a much lesser burden of virus where they may not get as robust of an immune response, whereas you know the exact amount of immunogen you're going to get when you get a vaccine. I agree. I think natural infection protects. I think that you could reasonably say that if someone says they were naturally infected, why should they be mandated to get a vaccine? I actually don't disagree with that. I have made that point several times. I actually published an op-ed in the Washington Post that I said natural infection should count. So I agree with that. Where Omicron is different is Omicron was a surprise. I mean, you know, we tend to think of flu viruses as being quite capable of drifting and shifting, meaning to be so dramatically different from one season to the next that you need a yearly vaccine. Where Omicron is different, that surprised people is that it has so many mutations in that so-called receptor binding domain that it drifted. So now you're not protected against mild illness if you have been previously naturally infected or vaccinated. I really think we're going to have to understand that at some level we're going to have to live with mild illness with this virus, in that like all mucosal viruses, which have relatively short incubation periods, I mean, time you're exposed to the time when you develop symptoms, you're going to be protected, I think against, you know, certainly serious illness, I would think for years, because that's mediated by memory cells, which tend to be long-lived, memory B cells, memory T cells, whereas protection against mild illness, for the most part, is mediated by high levels of neutralizing antibodies, which don't last. I mean, that comes down over time, and therefore you're susceptible to mild illness again. And right now we have this kind of zero tolerance strategy for this virus, where anybody who's mildly infected or asymptomatically infected, you know, are quickly, you know, quarantined. And if we're going to do that, we're going to be frustrating ourselves or boosting all the time, which is another thing we can talk about, because I think there's probably not an American in this country who can define what fully vaccinated means, because I think we've been so confusing about this.
I can see that for sure. I think everybody's confused. It went from 1 to 2 to boosters. And then I think people are still getting sick. And I know my daughter's boyfriend was traveling over to Jordan, and he had a layover in Kuwait. And before he flew out, they actually had him get vaccinated. And when he got to Kuwait, they made him stay there for a quarantine because he had COVID when he got there, but he didn't have it when he tested. So he had got tested, didn't have it, got the vaccine, traveled, ended up having it, and got quarantined, stuck in Kuwait. And so, you know, it was like, oh man, well, that really stinks, you know, but I think that's happening to a lot of people. I've heard, you know, chair people on health subcommittees and all these places saying, you know, I had COVID right after I had the vaccination, but I thought that's why I got the vaccine. And a lot of people say, well, maybe it wasn't as harsh as it would have been. You know, I think that's kind of what I think you're saying, is maybe it's a lighter version of COVID if you had it. But I hear things on both sides of that as well. So that's still hard to even, you know, I mean, just looking at all the different studies, it seems like the more vaccines you've had, and then if you do get COVID again, you're actually more likely to end up sicker, it would seem. So we'll get into that. I got a lot to cover here, fellas. So I'm going to switch off and ask Dr. New this question first, because I'm curious, because I think you would know the answer to this, because these are just things I'm hearing from doctors and immunologists, virologists, and people who are talking about this stuff. So Johnson & Johnson, Moderna, and Pfizer all went out of their way to eliminate anyone with natural immunity from their studies. Have you heard of this, and why would this happen? Is there a reason this would happen? What would the reason behind that be?
Well, again, that's not really, you know, study design is not my expertise. And
Oh, this was Dr. Offit first.
No, that's right. Dr. New can start first.
I'm sorry.
Okay.
I just flip flop if y'all guys don't mind it. It's up
That's
to y'all.
right. Let Dr. New start. That's okay.
Okay.
He's already started. That's not a problem. It's fine.
give him enough rope, he'll hang himself. All right. So, yeah, I mean, obviously it's not my area of expertise on study design, but and I'd like to know Dr. Offit's thought on it. Now, obviously, from our perspective, my understanding is the idea is to design the study to give you the best possible outcome. So you don't really want to complicate things by having people that already had COVID. Plus, at least in phase 1 and part of the phase 2, 3, they were looking at antibody responses. So I think it would mess up your study if you had people that already had antibodies. You know, our concern is always if you're not doing the trial on people that had COVID or have autoimmunity or are pregnant or all these other things. You know, that clinical trial is that one opportunity that you have to do a true, you know, placebo-controlled double-blinded study. All the rest of the stuff that we have after that is primarily going to be observational population type studies. They're much less quality than what you have with that original trial. But again, I'm dying to see what Dr. Offit has to say about that. But you know, that's our perspective. You want to get the best possible outcomes with your study, so you're going to use people that don't already have pre-existing immunity.
Makes sense.
I agree completely. I think this is going to be much easier than I thought. First of all, that was easier to do way back when I'm on the FDA Vaccine Advisory Committee, and when we reviewed those data back in December of 2020, that's when you could do those kinds of studies, because not so many people hadn't been infected with that virus yet in this country. You see that when we started to move forward, you know, when we did the 12 to 15, you looked at studies in the 12 to 15-year-old, the 5 to 11-year-old, that you could see that there were children who had already been naturally infected and were getting. So they had both of those people in the study, because it was hard. I mean, it was interesting to me, which I would have never guessed, was when we first reviewed the 5 to 11-year-old data, which was in October 26th of this past year. 40% of those 40% of children between 5 and 11 years of age had already had antibodies to the virus. So, because there's just a lot of asymptomatic infection out there. And I think another good point that Dr. New made is they only looked at neutralizing antibodies, assuming that that was an absolute correlate for protection against disease, and it's not. I mean, obviously there's more to it than that. It's you know, it's the old line, you know, why are you looking under the light? Because, you know, that's where you can see. And it's much easier to do neutralizing antibodies than to do, say, looking at memory B cells, memory T cells. Although those questions were asked, by the way, during the when those companies presented data, those questions were asked by our committee. You know, why didn't you also look at these other potential immunological correlates? And the answer is because it's much harder.
I mean, that makes sense to me. That was interesting, actually, because I was very curious about that, because I've seen people saying things and I thought, well, that doesn't sound right. Like, I know, you know, you kind of have to have that baseline group that doesn't have anything already there, or I think it would kind of confuse the test.
So, Paul, can you clarify with the original study from Pfizer, didn't they do ELISpot testing or some T cell, B cell testing? At least,
you know, I don't remember them presenting that to us when we were looking at those data. I think they had done that, but I'm not too sure they had done it in a manner that enabled you to answer that question about, you know, to what extent that correlated or didn't correlate with protection. Because I think they just did it on a smaller subset.
I was just reading through the Pfizer documents that have been released, and I think that was buried in there somewhere. I didn't see the results, but I thought they had tried to do.
No, it's a good point, by the way, that Dr. New made also earlier. You know, this virus has 4 proteins, and so the point is, when you're getting the vaccine, you aren't just getting an immune response to that SARS-CoV-2 spike protein. Isn't it also possible that those other 3 proteins have epitopes on it that will be recognized not just by antibodies, but especially by T helper cells and memory B cells? And the answer is yes to that. So sometimes there are advantages of being naturally infected. The disadvantage of being naturally infected, obviously, is that you can be hospitalized and die. I mean, the goal of the vaccine really is to produce the immunity that's induced by natural infection without having to pay the price of natural infection. So the word natural, I think, you know, is a word that I always have a little trouble with, just because, you know, not all things natural are good when it comes to viruses.
I mean, I've said that to people too, just when it comes to in general, not all natural things are good. That's like people talk about, well, aluminum's natural in the environment, but that doesn't make it something wonderful. You know, I mean, not that you know what I mean? I mean, there's certain things that they may be natural, but that doesn't make them great, you know? All right, folks. All right. So I guess I'm going to flip-flop it here, and I'm going to ask Dr. Offit, you want to start this one off? The vaccinated are still producing spike proteins up to 2 months after the vaccine, whereas the naturally immune are not. What does this mean, and what effect is this having on the population?
Yes, I actually don't agree with the premise of the question. So when you're inoculated with, you know, this lipid nanoparticle in which there's now a small piece of messenger RNA, that is taken up primarily by so-called dendritic cells, which are a specialized immune cell in the body that then does the following. First of all, that mRNA will join about 200,000 other pieces of mRNA that's sitting in the cytoplasm of the cell. So it is not an uncommon thing to have messenger RNA in your cytoplasm. It will then enter the so-called ribosomal system, where it will be translated to a protein. And then really three things happen. Either one, the protein is itself put on the surface of the cell, or the protein is broken down into these sort of 10 to 15 size amino acid peptides, and that's put on the surface of the cell. And then to a much, much lesser extent, it's excreted into the circulation, this protein. But really the purpose of the dendritic cells is to then go to the local lymph node and stimulate B cells and T cells, which are immune cells. The protein's probably not made for more than a few days. So the notion, which is true of all these, generally the proteins that are made, and then the mRNA breaks down. So the notion that it's constantly making protein is just wrong. It is a powerful immunogen, though. I want to underline that we give a lot of shots in pediatrics, and the only time I've ever seen this sort of level of lymphadenopathy, which is a testament to how old I am, it was with the smallpox vaccine. It's lymphadenopathy, meaning swelling of the lymph node underneath the arm. So it is a powerful immunogen, but I don't think there's good evidence that you're making protein for weeks and weeks and weeks or months.
You're on, Dr. New.
Yeah, I think what Lynette was referring to, and I'm sorry, I don't have a brain that can spew out author name and publication dates, but there was a study where they were doing biopsies of lymph nodes after vaccination. And I believe it was that they found the messenger RNA in the lymph nodes up to 2 months after vaccination. I think that's what she was referring to. Now, I don't know if that translates into that messenger RNA being translated into spike protein or not, because I don't think they measured actual spike protein, but there was some evidence, and I forgot the percentage, but there was a percentage of patients that had persistence of the messenger RNA in the lymph node. I think that's the paper she's referring to.
Yeah, I know exactly what you're talking about, Dr. New. So can I call you James? Is that all right? So
Yeah, call me New, please.
No, okay, no.
There's too many Jim and Jameses in my family, so.
Yeah, you're right. It was in the germinal center of the lymph node, as I recall that. But I think that there's what you said is exactly right. It's not necessarily, that doesn't necessarily mean that the protein is being consistently made.
All righty. All right. Well, all right. Next off, let me see here. I'm gonna go with Dr. New first. Looking at many studies around the world, including the United States, they show that vaccines do not prevent getting the virus, spreading the virus, getting sick from it, or even dying from it. In fact, some studies show that the mortality rates are higher in those who have had the vaccines versus those who have not. Would this be the time to pull back on the COVID vaccine push and reassess? And then also, under these circumstances, are the vaccines protecting the unvaccinated? Like that, it's kind of the whole vaccinate for the greater good thing. Is that happening with this vaccine as, they believe it is with other types?
Right. I think this might be a place where we're going to diverge in opinions, but, our whole issue has been one of vaccine mandates, that if you are concerned over COVID and you feel the COVID vaccine would be a benefit for you, then by all means get vaccinated. And none of us are telling you not to do that. The concern is, is it right to mandate this vaccine for everybody, particularly if somebody is at low risk from the disease itself? So if you take a vaccine like the measles vaccine apparently kills the measles virus. It is actually will terminate the virus. You don't get an infection. With the COVID vaccine, you can't say that. And again, Dr. Offit can correct me here, but there are a bunch of people that get infected with COVID after they've had the vaccination. Now, the argument has always been the benefit of the vaccine is that it lessens the severity, it decreases hospitalizations, it may decrease deaths. Okay, but that's an individual choice kind of issue, not so much an issue of mandates and, that I need to be vaccinated to protect you kind of thing. So if you have a person who gets vaccinated and has less symptoms, could that person then become, that asymptomatic super spreader that we were all worried about back in the early days of COVID before we had vaccines? Could that person be either asymptomatic or have minimum symptoms?
Right.
It's like when when I had Omicron, so I had early Delta, did fine with it, and then I developed Omicron. When I had Omicron, I mean, I basically had a runny nose for 2 days, and the only reason why I knew I had it was, I got symptoms. I swabbed; it was positive, so it was very, very mild symptoms. Now, if this was early on and I wasn't aware of COVID, I wouldn't have isolated. I wouldn't have quarantined, right? Because I didn't feel sick. So the same thing could be happening, in which case you could actually be spreading the disease to others. It's very, very difficult and we know there was a study from again, these are population studies, but there was a paper put out by the CDC and the MMWR where they looked at populations where these people were vaccinated, these people were unvaccinated. If you got the virus, and again, does the vaccine reduce the rate at which you get infected? That's possibly true. But if you actually got the virus, the rate at which you spread that virus to others was the same in both groups, according to that paper. So that would suggest you're not preventing transmission. Now, again, if you can show that you reduce the rate of infection, and this was the issue with the original studies, right? They never, the FDA never required any of the manufacturers to do regular testing of their participants. So if you did regular swabbing, then you would know who was positive.
Right.
They only swab people that were symptomatic. So again, if you have a vaccine that lessens or prevents symptoms, but does not necessarily stop infection, you're not going to know the true rate of infection because these people don't necessarily have symptoms. So the concern is always, again, if somebody is requiring everybody around them to be vaccinated in order to protect them, like they've had a transplant or they're on chemotherapy or something like that. I'm not sure exactly how much that's going to reduce the risk of transmission, but it certainly is not going to eliminate that risk.
Okay.
And that's different from, at least my understanding of traditional childhood vaccines, particularly things like measles or polio or those kinds of vaccines where you're actually preventing the infection.
Right. So just for the beginning of the person who asked that question, if you get vaccinated, you dramatically lessen your risk of being hospitalized, go to the ICU, or go to the morgue. I mean, that's not a question. Vaccines work to prevent serious illness. But then the question is, and it gets murkier with regard to what you can expect in terms of protection. Dr. New is right. I mean, when you're given, there are different kinds of viruses. There's the so-called systemic viruses, like measles, mumps, German measles, chickenpox, where virus spread in the bloodstream is an important part of the disease process. As a consequence, incubation periods from the time when you're infected to the time to when you develop symptoms are longer, 10 days, 12 days, 14 days. For these so-called mucosal viruses, rotavirus, influenza, coronavirus, the incubation periods are much shorter because virus spread into the bloodstream is not part of the disease process. The virus reproduces itself at the site of entry. It doesn't spread into the bloodstream and then go elsewhere, which takes time. And that time matters because all of these vaccines will induce reasonable frequencies, either from natural infection or immunization, of memory cells. But when you have long incubation periods, there's plenty of time for activation and differentiation of those memory cells to become, let's say, antibody secreting cells, so you can completely protect against even mild illness for a long period of time. And therefore, you can eliminate those viruses. You can eliminate measles. We did eliminate measles from this country by the year 2000, but a critical percentage of people stopped giving the vaccine. So the disease to some extent has come back, not nearly where it was, but to some extent it's come back. You can eliminate polio, as we did. We eliminated polio from this country in the 1970s because it has a relatively long incubation period. If everybody in the world got a rotavirus vaccine or an influenza vaccine, you still wouldn't eliminate the virus for just the reasons that Dr. New said, which is that you're not going to really protect as well against, certainly over time, against mild illness or asymptomatic infection. In terms of mandates, there was, I think, one of the several miscommunications that have been associated with this virus was there was a study done back with that July 4th outbreak in Provincetown, Massachusetts, where what they did was they looked at people who were vaccinated and then had a mild illness and compared them to people who were unvaccinated who had a mild illness to try and answer the question, Were they shedding just as much virus? Were they just as contagious if they'd been vaccinated or not? And unfortunately, they used a PCR test, and they did it just a day or so into the illness to answer that question. It showed no difference. That wasn't the right test. I mean, the right test to do is to look at infectious virus. Look at the amount of infectious virus that's spread. That's not a tool that's commercially available. You can't do that with PCR or antigen testing. You actually have to look by studies like focus forming assays or plaque reduction neutralization assays. That study has been done. And what you find is that you do shed significantly less virus for a significantly shorter period of time, but you still can shed. That's true. So you still can be contagious. In terms of mandating, I mean, I think that certainly if everybody in this country got a vaccine, I think we would have less disease than we have now. We would. So then the question becomes, you know, if you do get a vaccine, you have a lesser chance of getting ill. You do. You don't eliminate the chance, but you do have a lesser chance of getting ill. I mean, I'm not shockingly, I'm fully vaccinated. I have not gotten this infection yet. So, and I have a lot of friends who haven't gotten this infection yet. But I could have. I mean, I certainly have friends who have gotten this infection. And when they get this infection, they say they could shed. So should you mandate? Personally, I think in a better world, you wouldn't need mandates. I think people would see that this vaccine is of value and they'd all get it. But I do think mandates is where the rubber meets the road in terms of inducing anger. People are angry. And I think with the natural infection thing, I just want you to know I have been on record talking to a number of people and publishing op-ed pieces saying, I always thought natural infection should count. It should. And where you had mandates, I thought if somebody comes and says, look, I've been naturally infected, I don't think I should be mandated to get the vaccine. I actually agree with that. I mean, bureaucratically, it's difficult in our hospital, for example, for someone to say, look, here's my PCR test or here's my antigen test. You do have to trust them. Probably the best way to do it is to get serum or get blood and then say, look, I have antibodies against the viral nuclear protein. That can only happen if I've been naturally infected. But bureaucratically, obviously, that's very hard. The administration did consider this. I want you to know the administration considered counting natural infection. They ended up not doing it, I think largely for bureaucratic reasons more than anything else. But I think basically I agree with what Dr. New said. And so, but I do think in terms of, I guess I wish we didn't have to talk about mandates. I wish just everybody would realize that vaccines are valuable and they'd all get them, and the world would be dominated by logic and reason, and you know, we'd all live happily ever after. We don't happen to live on that planet, but you know, that would be nice.
If we did that, then I don't know if my children would still be here. So I can't jump on that one. That's, as a mother and having seen what I saw, it's just something different, Dr. Offit. I mean, I didn't have a clue until it was right before my own eyeballs. And you could offer me $1 bajillion. You could offer me anything in the world and I would never do it. Never. I mean, and that's just the mommy in me, knowing that I have to protect. So we'll have to agree to disagree on that one, because that one just makes all my insides hurt.
Well, I think that the biggest problem that a lot of us have with vaccines is that it's that one part of medicine where, number one, everybody's supposed to take the same thing. Number two, there's such a huge bias against anything negative. I mean, it's so difficult to publish anything negative on vaccines, just the way the journals are working. And it's hard to get funding, and it tends to be career suicide if you start saying, you know, this vaccine causes this problem or whatever. I mean, we all know these vaccines have side effects. I don't think anybody is questioning that. You know, the issue with the COVID vaccines is this whole question of, you know, is VAERS telling us something or not? You know, if you've got whatever it is these days, it's over 1 million reports and 25,000 deaths, and, you know, on and on and on. You know, what is that all about? Because, you know, we've been complaining about VAERS when there were 50,000 reports to it, and a few hundred deaths. So, you know, it begs this whole question of what price are we paying? Because if I'm going to take a medication, at least I know exactly what risk I'm taking with that medication, and then I can decide I'm going to take it or not take it. And you know, the government's not going to step in and says, you know, you have to take Lipitor or else. I can decide for myself, should I do that? Should I not do that based on the evidence that's available? And that's not the case with vaccines. And it also seems, and you know, we can talk about the CDC, and you know, I'm sure we have very differing opinions on the science that's coming out of the CDC when it comes to these vaccines. But you know, that's another area of concern we have. And then the other thing that I want to point out is that In my world, and again, I do integrative medicine. I'm all about maintaining health and that sort of stuff. Vaccines are not the only thing that we can do to help somebody either prevent an infection or get through an infection without having an adverse outcome. So that's again a little bit differing point of view from what I do versus mainstream medicine, where mainstream medicine for a virus like COVID, up until recently, we didn't have much, right? We had monoclonal antibodies and maybe remdesivir, but we really didn't have anything to treat it. And in my world, we had many things to treat it. And basically, no patient I've had that got COVID has been hospitalized or died. And that's hundreds and hundreds of patients that have had COVID in my practice. So it's not just, vaccine or nothing, because if it's vaccine or nothing, then maybe you are better off taking the vaccine and taking your risks with it. But there's this entire world of treatment out there that works, that isn't part of what mainstream medicine does, and is a huge part of what I do in my world.
Right.
Okay, couple things.
Okay.
I think prevention is always better than cure. I think if you can prevent a disease, successfully prevent it, because I'm glad that Dr. New has had enormous success treating it, but not everybody has. And there's I guess we all have our biases. I work at Children's Hospital Philadelphia. Last time I was on service, we admitted 18 kids to our hospital. All were over 5. Not one of them was vaccinated. And if they had been vaccinated, I think they were much, much, much less likely to be there. In terms of side effects, I guess I don't completely agree that we're uncomfortable publishing, say, adverse events. I mean, when this vaccine rolled out, very quickly, the Vaccine Safety Data Link looked at whether or not there was a problem with the mRNA vaccines, and that's why it was found to be a rare cause of myocarditis, and that was all very quickly published. Same thing which would occur, I mean, primarily in that 16 to 17-year-old age group, around 1 to 5,000, 1 to 7,500 was the greatest risk. And then if you look at the 16 to 29-year-old, it was around 1 to 20,000, depending on what studies you were looking at. And then with the so-called bleeding problem associated with Johnson & Johnson vaccines, that was a 1 in 200,000 person phenomenon. And yet that was picked up and reported. So I think people do report. Dr. New has a higher opinion of drug safety studies than I do. I mean, I think that the Vaccine Safety Data Link, which is there to, when vaccines roll out, obviously not everybody gets them. Some people get them, some people don't. So you can see what the problem, if there is a problem, what the problem is. I wish there was a drug safety data link. If there had been a drug safety data link, I think we would have learned that Vioxx was a rare cause of heart attacks much quicker than we did. I think drugs are given more of a pass than vaccines, actually, which I think are fairly tightly looked at in terms of the things like Vaccine Safety Data Link, the V6 system, the FDA's PRISM system. VAERS is at best a hypothesis generating mechanism, but I think it is misused. First of all, it's misnamed. I think anybody that looks at that name, Vaccine Adverse Events Reporting System, assumes that everything that's reported is a vaccine adverse event. And it's not. It's a suspected vaccine adverse event, and it either will hold up or it won't hold up. I mean, people point to that system and go, look, thousands of people have died from this vaccine, and that's just wrong. So I think people can be confused by the VAERS system.
Well, the issue that we have is obviously and maybe I'm incorrect, but I was under the impression the paper that CDC wrote on, or at least the data the CDC wrote on myocarditis, was based on VAERS and on the VSafe, and not on the VSD. That they had published in MMWR, I forgot when, but where they were talking about, the risk of myocarditis is less than the risk of COVID, and therefore we should vaccinate. But that was not, my understanding was that was not based on VSD. Are you talking about the JAMA article where they looked at all outcomes based on VSD? Or?
Right. So where VAERS is at its best is a hypothesis generating mechanism, where it was, if actually myocarditis was originally picked up in VAERS, but again, when you couldn't really tell what the relative incidence was, because myocarditis can occur in the general population. It also occurred with COVID. With the Vaccine Safety Data Link, and then ultimately with the PRISM system by FDA. So you're right. I mean, the VAERS at its best with the rotavirus vaccine, the RotaShield vaccine that was introduced in the late 1990s in this country, was picked up as being a possible cause of intestinal blockage. VAERS picked that up, but that didn't prove it. Because VAERS can't because bears doesn't have a control group. So the only way you can do that is to look at a control group, which showed that in fact it was a rare cause of interception. So bears isn't worthless, but I think it can pick things up and did pick things up. It picked up myocarditis. I think it picked up this clotting problem, but it can't test it. That can only be tested in a controlled with a controlled system like VSD. I wish there was a drug safety data link. Honestly, you have a much higher opinion about how drugs are monitored than I have.
They're monitored for longer periods of time than most.
I think too, the point is that vaccines can't be talked about. I think I'm lucky. I have a 65-year-old general practitioner who, it doesn't matter if it's the simplest thing or not. He goes through everything about it with me for my children, and even for myself. He sees my whole family. And, he tells me, I'm not going to make you do anything. I understand, your kid's best, and let's talk about this. And here's what it could do. And here's what I think the benefit of this is. And a lot of times I'll go with whatever he chooses because I trust him as my physician, and he showed me my options and why. And I think that that's the part that makes more parents nervous, is that part gets forgotten because we're hustled in and out in a 15-minute visit. And so it's harder to fit in all those things we need to hear to be more trustworthy of the system as well, because that's a conversation that it takes more than 15 minutes.
I agree. I think that the system is not set up well. You go in to see your doctor. For the most part, your doctor is looking at the computer screen and typing things, and when you're talking to them, they often don't examine you for a very long time. They don't spend much time with anticipatory guidance and stuff. It's my wife's a general practice pediatrician. She'll see 40 or 50 patients in a day, and that's a situation that is not optimal. I agree.
Yeah, my doctor actually spent over an hour with me my first visit. He actually told me meeting me was like stepping in front of a fire hydrant, but in a good way. And I was like, well, good, And so it's funny though, because he didn't understand ASIP happens. He had no idea so many of these things are going on. And he's been a doctor for 40 something years. And it's like, it's so odd. He's like, well, how did you find out about this? And we get to talking, and it was interesting because he's so old school. He says, well, I believe that everyone at least deserves a choice, because I've been around long enough to see that there are injuries. And he said, he's of course the one that helped whenever stuff happened with Jazzy and her intussusception and different things. And so of course, I respect him, and then it was great to have some help. But for parents, Dr. Offit, I think the one main thing a lot of us really do just want you to understand, and even as physicians, for some of my friends like Dr. New, is none of us are really just horrible people, and none of it, I love you to death. We know each other very well. And so a lot of us, I think we've been labeled a certain way, the same you've been labeled a certain way. And I never like hearing people say things or negative things about you. I always clap back. And, and it's one of those things where it's like, at some point, I just hope, like what's happening today, we all just learned we can do this. We can talk to each other. We can respect each other. We can agree on things. We can disagree on things. And, it's so hard to get to these points, but, oh, it shouldn't be this hard. It just shouldn't. It's like being at ASIP. We've all been in the same room several times together, but that velvet rope and those things just kind of make us feel kind of separate. And Dr. Offit and I have gone out of our way to form this friendship. It's not like it was handed to us or something, And so it's one of those things. It's like, I sure hope that this helps other people see that neither side is just a bunch of monsters. We're not all crazy. I don't think any of us here are just crazy people. We all just have valid concerns and come from different perspectives. And I think that, that's something that really needs to start being understood more. We could have a lot more discussions and talks like this, and people need to stop being afraid of the discussion and just respect each other. You guys are doing awesome. I'm so proud of you guys.
I got to tell you, before we did this, I mean, certainly a number of people asked me whether I had lost my mind for doing it. But, so I was nervous about this, actually. And I can't tell you how happy I am and how impressed I am with Dr. New. I mean, it's just a perfectly reasonable conversation by two people who at least are basically having a discussion on the same data. You can have a discussion about the importance of mandates or the use of mandates. You can have a discussion about booster dosing, which has been incredibly confusing, or various aspects of this can reasonably have two sides. You can't really have two sides on whether vaccines work, for example. I mean, mean, it's just, but for the most part, there's much gray in this that is worthy of discussion. And Dr. New, has been a complete pleasure. Thank you. I really appreciate this.
I'm really not that bad, and I really am not that great. Although some days less than that. No, I mean, the important thing to understand is, you know, we've come to where we're at right now through different routes. So, you know, you're in academics, you're in research, you know, I'm in clinical practice. You know, what changed my course, because, you know, I went to medical school, I believed everything my professors told me, you know, vaccines saved mankind. They used to think parents who didn't vaccinate their children were evil. It was like child abuse kind of thing. And, you know, as an ER physician, I was, you know, bringing the hammer down every time somebody came in who was unvaccinated. And, you know, I was one of those doctors. And then, you know, some personal experiences, but mainly when you open an integrated practice, you know, people come see you where they don't get answers elsewhere. And I start seeing these kids, and these kids where, you know, the parents would say they were injured, or adults that say they were injured by vaccines. And it's like, I didn't know that could happen. And I thought this was a 1 in a million thing. I mean, what's going on? And then, you know, you start researching as to what these side effects are, and you sort of run up against a wall in terms of there's not a lot of data out there that tells you, you know, what is the frequency of this or that event. Because again, if you're going to tell me that, you know, it's 1 in a million, well, good Lord, they're all at my office, right? Because, you know,
Can I just butt in? I'm sorry, but you just
sure.
said exactly what they told me, Dr. New. When this happened with Lily and she had thrush and she got the 6, when I took her to Children's, that is what they told me. I mean, that was what they said word for word. And I mean, I was just kind of mind blown that we didn't even know vaccine injury was a thing. Like the hematologist was like, I swear, we just like overwhelmed her system. You know, and they were like, she's 1 in a million. And then, you know, I went through this with Jazzy and Intussusception. And that's when it was like, but I thought you guys told me this is 1 in a million. I got 2 kids who've been injured now. That's not 1 in a million. That's the math is off. So that's where for me that became like, you know, where I kind of was in, you know, what in the world's going on here. So I think that's where a lot of us kind of come from is more we're it's different for everyone. And if you don't know, like I wouldn't have known if I hadn't have thought about it. Like, man, this happened on the same day as this. A lot of people don't until you go back and think about it. So I don't know, you know, I know Dr. Offit doesn't really see things the same way. I know we've talked about what happened with my daughter and her intussusception. We talked about when we had our first lunch, actually. And he said that was actually textbook intussusception from vaccine, which it was. I mean, they all freaked out. They wanted to go to the hospital now. She could die, all this stuff. And I'm like, what is going on? I didn't even know this was a thing. So, you know, I mean, it is scary for us parents, and it's scary to trust again when you feel like, oh my gosh, like my child could have died. These people were panicking, and these people are the ones who are supposed to be calm in these situations and know what to do. So it does scare parents, and it does make you way more apt to go, okay, maybe I should be reading more about this. Maybe I should be looking more into this. And it's exhausting. I'm gonna be honest with y'all. I liked life before I had to know all these things a lot better. If I'm being honest, it was way easier to be me. But I wouldn't know you interesting folks, and I wouldn't be able to have the moments I have. So you know what? We're just gonna be happy God put us where He put us, right? I'm gonna move on. You know, you guys are doing awesome. I'm sorry if some of my stuff is, you know, it frustrates. I can tell it frustrates you a little bit, Dr. Offit, but I can't help that.
Well, I would just say this. I think, I mean, can vaccines cause serious harm? Of course. Can they cause fatalities? Of course. I mean, anything in medicine that has a positive effect can have a negative effect. Vaccines are no different. The smallpox vaccine can cause inflammation of the heart muscle or inflammation of the lining around the heart muscle. The measles containing vaccine can cause a lowered platelet count. The I think swine flu vaccine that was used in Europe, Pandemrix, was a rare cause of narcolepsy, which is a permanent disorder of wakefulness. The yellow fever vaccine can cause something that has the fancy name of viscerotropic disease, which is another way of saying yellow fever. Rare but real. The oral polio vaccine could itself cause polio. And I think when people raise the question, could this vaccine have done it? My child was fine and they got a vaccine, now they're not fine. I think it's incumbent upon the academic or public health community to answer that question. What frustrates me is when it's answered and then people don't believe it. I mean, this is probably, it's too big because we were doing really well, but I do think when the issue was raised about whether the combination measles, mumps, rubella vaccine could cause autism, that's been studied and it doesn't do it. And yet, there's just still a certain group of people who you're never going to convince of that. And I think that there should be more of an appreciation for people trying to answer those questions, and then when they're answered, believe them. But there's just a lot of misinformation out there about vaccines that cause people to make bad decisions that put themselves and their children at harm's way. And that's what I see. I mean, I'm also a clinician. I mean, I do round in our hospital. So, I mean, I do see that. And I guess we all have our biases. Mine is it's very hard for me to watch a child come into our hospital who had a vaccine preventable disease who suffers it. It's hard. Maybe it's because I was in the hospital myself as a child for a fairly long period of time, and I see myself in that bed, but for whatever reason, it gets to me.
Yeah,
Polio ward. I was in a polio ward at age 5.
Yeah. Again, this is the different paths that brought us here. And that's part of why we have differing points of view as to how to use vaccines and, whether they should be mandated for everybody. Because again, I'm not going to say get rid of vaccines. I'm not going to say that nobody should get a vaccine. What I am going to say, and I've seen this, I mean, I've had patients like this where, they have a bit of a reaction to a Tdap vaccine, and then they work in a hospital and they're mandated to have a second one. And you write a letter saying, I don't think this is a good idea for this person to get this vaccine. And you get overridden by the hospital's medical whoever and says, oh, that's a bunch of garbage. Those kinds of events don't happen. They get the vaccine, and then the next thing you know, they have small fiber neuropathy, or they have, some sort of a fatigue syndrome or some ill-defined illness that developed as a result of the vaccine. And again, you have doctor after doctor saying, oh, it's not the vaccine. And yet I have a whole population of these kinds of people. What am I supposed to think? So I'm not, again, you're coming from the point of view of you see these kids in the hospital with a vaccine preventable illness that you believe could have been prevented had they been vaccinated, and they're now in the hospital sick, right? And then I see the other side, kids that were healthy that got a vaccine and now they're sick, right? So we're coming from two sort of opposing points of view. And again, it comes down to, should somebody have to give their child a vaccine if they think it's not the right thing for them? Should a physician be able to say, I don't think it's a good idea for this person to get a vaccine for X, Y, and Z? And then number 3, why aren't we looking for why some of these kids have these events? Because there's very, very little research done on, whether it's genetics or it's epigenetics or it's toxicity or God knows what. What is it that makes this group of people respond so adversely to this vaccine where everybody else seems to do okay? Then we can figure out who not to.
I understand what you're saying. I think, again, where we somewhat different, it's too bad we continue. We should have stopped about 10 minutes ago because we were really agreeing. But I think what I would say is that there are claims about what vaccines do in terms of harm that are not supported by studies that try and look for that. I mean, if you look at the MMR autism thing, I mean, there's a lot of people who still believe this is true just because they were compelled by the temporal association. And I'm just saying temporal associations are very compelling. My wife is, and I've told this story to Lynette before, but my wife's in private practice pediatrics. She goes in on a weekend, she's helping the nurse give vaccines. And so there's a 4-month-old sitting on her mother's lap. True story. She's pulling up the vaccine into the syringe. The 4-month-old sitting on the mother's lap has a seizure, goes on to have a permanent seizure disorder, and is dead at age 5 of a chronic neurological disease. I think if my wife had given that vaccine 5 minutes earlier, there are no statistical data in the world that would have convinced that mother of anything other than the vaccine caused it. And so when you look at that, when you try and do statistical associations for whether there really is evidence that caused it, you're never going to convince that mother of that. And I mean, this is where we differ somewhat. But I appreciate that you that we're trying. We are trying to find some way.
Can I say something in that way as the mother? if when the mother comes forward and just tries to talk about it, if they weren't automatically treated like they're crazy and shut
No, I agree with
down,
you. I
that
completely,
would make a big difference,
I agree
because
with you.
that's how I was treated, was like, you're insane. There's no way that could be what happened, until I made it to Children's of Birmingham and I talked to the Center for Infectious Disease doctor. And then he came in and he was like, look, this lady's not going anywhere. We're admitting this kid. Here's what happened. And we need to be paying attention to this. And we went into quarantine, all kinds of stuff. I mean, she was on Neupogen injections for 3.5 years to have white blood cells again. Like, it was horrible. And so, it's a very different time. And it's something that, if they had just said, you know what, this happens, and here's what you need to do, and here's how we help her, and no, you're not crazy. I mean, I had no idea about this stuff on the board before I ever questioned one thing about vaccination. I still have a picture of it on the hospital board. It says, if immunizations did not do this, what did? Before I vaccinated her, she just had thrush, and that's why we were there. Now y'all are acting like she's dying. She's pale as a ghost. She can barely get up. She can't lift her arms. They say she's going septic. Her body's shutting down. Oh, next thing we know, she's got autoimmune neutropenia, all these things, and she was fine. And so, to have them come in, and they brought in oncology, hematology. I thought my baby was going to die. And if they had just said, you know what, here's what happened. Let us look into this. Let us report this. Let us see if we can figure this out and help you. I would probably be a whole different person today than I am right now. That's why I told the CDC they are creating mothers like me, because nobody just tries to help you if it does happen. They just go, there's no way that happened. You're crazy. Sit down, woman. And there's got to be, the system's got to do better.
And that, again, I think that arises from our training as physicians. We're really not taught what, there's some basic, anaphylaxis or Guillain-Barré or something like that, sort of the basics of what you can see as a vaccine response, but we're really not taught, are there, what are the long-term sequelae of this? What types of things should we be looking for? And, again, Dr. Offit can chime in on this as well, because he comes from a different perspective. But, everything I learned about vaccine injuries, I learned after I was, done with my training. I learned this in practice from mothers that came in and said, this happened to my child. And, if you hear it once, it's like, well, maybe she's crazy. Maybe it was like what you were talking about, Dr. Offit, where it's, this kid would have had a seizure one way or the other. But, when you hear the same story time and time again, then you start getting worried about it. And at least in my practice, the changes, the kids, I see a bunch of autistic kids in my practice, and, I can say, are some of them, did a vaccine cause some of their autism? I think the answer is yes. If the question is, can vaccines cause autism? I think the answer is yes. Do vaccines cause autism? The answer is no. There's other causes for autism other than just vaccines. That's one of many things. This is a spectrum disorder. It's not like right lower lobe strep pneumonia, where we know exactly what's causing it. It's a spectrum of illnesses. But most of the parents talk about changes well before the MMR. Again, the MMR is the one that got all the press. And there's a bunch of studies that, if we're going to accept the validity of the studies, then we have to say, yeah, MMR doesn't cause autism, but there are other things that lead up to that. The big issue we have, and this is really where I'm coming from, because what I'm interested in is health. Are we healthier because we vaccinate? Now, the answer for something like polio is probably yes. But what about some of these other diseases where it's not necessarily as severe for the child? Do we pay a price for that vaccine? And I think that's what we don't get from the scientists. That's what we don't get from the CDC. What is that price that we pay for the vaccine schedule that we put on our children? Because pediatric health, like adult health, has gone downhill in the time that I've been in practice.
Right. So this is where we just disagree. Are we better off because we have a polio vaccine? Probably. We're definitely better off because we have a polio vaccine. We're definitely better off because we have a Haemophilus influenza B vaccine. We're definitely better off because we have a pneumococcal vaccine. Rotavirus would cause 400 children to be hospitalized in our hospital every winter. Most of the residents have never seen rotavirus-induced dehydration. I think vaccines make us healthier. We live longer. We live 30 years longer than we did 100 years ago largely because of vaccines. I mean, so in terms of whether vaccines cause specific chronic illnesses, you and I just disagree about that, but that's okay. At least we're doing it respectfully, which is what I was scared might not happen. So that's good.
I mean, the only way that we can really answer that question is you have to look at a group that has been vaccinated, a group that's not been vaccinated, trying, control for all the variables and determine outcomes. The thing is, I'm not questioning, does a polio vaccine stop polio? Obviously, the oral polio vaccine is what eliminated polio from the United States. There are people that argue that, but I believe that's what happened. That's what the science appears to say what happened. But we're not even using that vaccine anymore because obviously the oral polio vaccine can cause polio, and the only cases of polio we had in the U.S. were vaccine, whatever they call it, vaccine-induced polio. So we use the shot now, right? We go back to the injectable polio vaccine. But the question is really long-term health. How does this impact long-term health? Because I would argue, obviously, all these arguments because you've heard them all, and we all tend to say the same thing over and over again. But, I think good nutrition, public sanitation, antibiotics have made a bigger impact on our longevity than vaccines have. And again, I know we're going to disagree on that one, but that's where I came from. So,
well, you'll be happy. You'll be happy to hear this. So Jonas Salk introduced his polio vaccine, his inactivated vaccine, the vaccine shot in 1955. And we used that until the early 1960s. And then we switched to the oral vaccine. And because of that, we were able to eliminate polio from this country, at least wild type polio, natural polio. But we never eliminated polio because every year, 8 to 10 children would get polio from the polio vaccine, so-called vaccine-associated paralytic polio VAP. I came onto the ACIP as a voting member in 1998. I asked to be the head of the polio working group because I wanted to get us away from that vaccine. There were Scandinavian countries that had only used an inactivated vaccine and had eliminated the virus from their country. There's no reason we should have continued to use the oral polio vaccine. And so I asked John Salamone, whose son had been paralyzed by the polio vaccine, who had an unknown, actually, immune deficiency at the time, to come on that committee. I asked him to be on that committee so he could be the face of what that looked like. And then it took really 2 years for that to happen. But I consider that, frankly, my greatest accomplishment on the ACIP was getting us away from the oral vaccine. So I'm more of a vaccine safety activist than you may be giving me credit for.
I know the history. I've read all that. And we all appreciate that we're not still taking that oral polio vaccine. So.
Right. Lynette, how are we doing? We're at about 3 o'clock. Because I have another meeting coming up, but
yes,
I'll
sir.
move if you need.
All right. I want to ask this question real quick because honestly, I want to know the answer to this one because I don't understand this. And you guys know me, I'm not a doctor or scientist or any of the accolades you guys have. So, so I heard that the mRNA vaccines are blocking the p53 receptor, and that means that DNA can no longer repair itself, and that it causes the autoimmune disorders, cancers, Guillain-Barré syndrome, and all these type of things to skyrocket because the body can no longer repair. What exactly does this mean? Is this correct? Am I understanding it correctly? These are studies I was reading that as I said, as a layperson, it's hard for me to kind of understand some of the stuff I'm reading when it's doctor terms. So Dr. Offit, if you want to answer first this time, feel free.
Yeah, no, I think, whenever you get the difference between the mRNA vaccines or even the Johnson & Johnson vaccine is, well, let's start with the mRNA vaccines, it's a genetic vaccine. I mean, you're giving the gene that codes for the protein. I mean, normally, say with the hepatitis B vaccine or the human papillomavirus vaccine, you're giving the protein. Or with the polio vaccine, the inactivated polio vaccine, you're giving the protein. You're not asking the person's cell to make the protein. And so what do? You give a gene, a piece of mRNA. And I think the minute you do that, you scare people that you could in some way alter your genes. But mRNA is a natural phenomenon. I mean, we all have mRNA, 200,000 copies roughly per cell of mRNA, and it can never enter the nucleus. It can't do it. It doesn't have a nuclear access signal, so it can't get into the nucleus. 2, even if it got into the nucleus, it's RNA, not DNA, so it would have to be reverse transcribed back to DNA, which it can't do because it doesn't have the enzyme. And 3, even if it did that, it has to be integrated, which requires another enzyme, integrase, which it doesn't have. So the notion that this in any way affects DNA or DNA repair is just wrong. I don't know how else I can say that. There's many things to worry about regarding vaccines, and I think myocarditis was an unpleasant surprise. I think clotting was an unpleasant surprise. But it's just what frustrates me in this is there's just a lot of misinformation out there that is based on fear but not fact.
So there was just a recent paper. This is a liver cell line that they used,
I
right?
saw it, right.
Yeah, and so in that case, they suggested that they were able to reverse transcribe the messenger RNA into DNA. Now, the argument there is that those cell lines are all contaminated with retroviruses. Retroviruses have that kind of machinery. The question is, are our cells contaminated with retroviruses? Because there are definitely human retroviruses that we all carry. Could that happen? Maybe. The bottom line with the and this goes along with, because there's papers on, does it affect toll-like receptors and some of these other things that are involved with recognizing cancer and then going after cancer. P53 is basically, to have cancer, you have to have some sort of alteration of P53. Now, usually that's going to be a mutation because that's sort of the cell death signal. If P53 is not functioning the way it's supposed to, then the cell, when it gets the signals, will not actually go through what we call apoptosis, which is programmed cell death. So if the cell gets damaged enough, P53 is the thing that says, okay, time to give up the ghost, time to take everything apart and give it to our cells. That's what P53 does. So, I mean, theoretically, if you did something to block P53, then yeah, that could affect your whether or not a cell, whether or not you can be able to fight cancer. But regardless of whether it can be reverse transcribed into the DNA, which is what Dr. Offit is saying. You'd have to have this in the nucleus, not out in the cytoplasm of the cell. It'd actually have to get into the nucleus to do this, which typically messenger RNA does not do unless it's somehow reverse transcribed. But the bottom line with all this stuff is, until you do long enough studies, you don't know whether or not this is a risk, right? I mean, this is the whole issue of fertility and, distribution and all that stuff that, when you have this warp speed, when you're in a crisis and you have this warp speed kind of development, you're going to have to cut corners somewhere. And obviously, if you're going to develop a vaccine in a year, you're not going to have 5, 10, 20-year studies to say, right, oh yeah, this increases your risk of, non-Hodgkin's lymphoma, or it increases your risk of this or that cancer. Unfortunately, I don't think we have that data on any vaccine, but we definitely don't have it on these COVID vaccines because of the time involved in the development process. So, could that happen? I don't know. I mean, people are publishing these papers, they want to have a mechanism in there, and it's important to know all this stuff. But until you actually, put the rubber to the road here and actually do clinical trials, and even if it's just with animals, to be able to say, okay, we had an increase, let's say we have a set of mice that are more prone to develop cancer because they have all these things available. If we expose them to this vaccine, is that then going to increase the rates at which we see the cancer? So those kinds of studies weren't done, and they had very few studies looking at some of the other things with animals. And again, that's just the way to develop.
That's something Dr. Offit actually expressed way early on in one of our interviews, was how, even his vaccine was studied for 20 plus years, and it still had to be pulled once and had issues and had to be, fixed and do all those kind of things. So
it was never pulled. The Rototech was never pulled.
Okay, well, I mean, I'm sorry, I don't remember how you worded it, but you know what I'm saying.
That wasn't our vaccine.
Okay, well,
Can I just say one thing in response to what Dr. New was saying? I think, I wish they hadn't used liver cancer cells. I mean, but they're looking at an immortal cell line, which is essentially a cancer cell. And if you're trying to prove that there's a difference with, say, DNA repair, do what you had just suggested, do the animal model studies. I mean, it's at least a little closer to the natural situation. It's interesting with the toll-like receptors. I mean, that's Drew Weissman's work. When you mention toll-like receptors, mRNA is a pro-inflammatory stimulus, right? I mean, it does stimulate toll-like receptors 3, 4, and 8. And so the only way that was ever going to be a vaccine is if you made it so that it couldn't do that. I mean, mRNA used to be an adjuvant, actually, for early rabies vaccines, you'd be interested to know. But and so that's what he did by essentially using these nucleoside analogs, so-called pseudouridine, which was the breakthrough that may well win him the Nobel Prize. But So that was to me, I mean, I think to me, the most amazing aspect of this vaccine, the mRNA vaccines, is that they were made in a manner, and this is Jason McClellan's work, so that it can't really, it's pre-fusion. It's a pre-fusion protein. It's locked in the pre-fusion state, so it can't really fuse to cells. So I think between that and the sort of making it so that it can't be a pro-inflammatory stimulus, I think it was what made this a vaccine. And it's remarkable work. I'm sure these people, Drew, I know because I've known him for years. It's interesting, the mRNA technology, everybody thinks, okay, now we can do it for everything. But the mRNA technology, which was originally worked out in the early 2000s, around 2004, 2005, the original virus they were interested in, obviously it was not this one because it wasn't around yet. The original virus they were interested in was HIV. And it just wasn't nearly as successful. But Lynette, I hate to bail, but I
No,
really
you're
think
good.
that's
You guys, I was going to say, I know everybody's got other things to do. Hopefully we can do this again one day, you guys. I think you kind of realize that it's not that bad. I didn't have a heart attack today, so I'll see y'all another day. I love you both. I appreciate you both. God bless y'all.
nice
And
meeting you, Dr. New. Take care.
Nice
all
meeting
right,
you.
you guys, we will talk soon. Y'all have an awesome day.